How can you detect a silent stroke? If there are no obvious symptoms, is that even possible? Let's approach this from a different angle, like an ancient military strategy. Know your enemy, know yourself, and you will win every battle. In modern terms, when it comes to your health, understanding your risk and recognizing hidden threats gives you a powerful advantage. And that's exactly how we must approach silent strokes, a dangerous enemy that hides in plain sight. By learning what puts you at risk, how brain damage occurs, and how your personal health plays into it, you can take steps to protect yourself even before symptoms show up. So, what exactly is a silent stroke, and why is it so frightening? In simple terms, a silent stroke happens when a small area of the brain suffers damage due to a temporary interruption in blood flow. The nerve cells in that area are starved of oxygen and nutrients, and over time they begin to die off. Unlike a typical stroke that affects major areas of movement or speech, silent strokes often target parts of the brain that don't control obvious functions. That's why people don't show the usual signs: no facial drooping, no slurred speech, no numb limbs. If there are symptoms, they're often so subtle they get ignored, misinterpreted, or simply dismissed as just getting older. So the real question is, how can you spot these quiet signals before it's too late? Even though it's silent, a silent stroke still leaves behind subtle warning signs that you can absolutely recognize if you pay close attention. Unusual memory loss. You may start forgetting recent events, have trouble concentrating, or struggle with simple information processing. Emotional instability. You may become overly emotional, overreact to situations, or laugh or cry inappropriately. Controlling emotions becomes more difficult. Unsteady walking. Your gait may become unstable, you may stumble easily or have trouble keeping your balance, even without any obvious injury. Disorientation in familiar places. Sometimes you may feel lost or confused, even in places you know well. Loss of bladder control. Some people may experience urinary incontinence without a clear cause. What's concerning is that brain damage from silent strokes is often discovered by accident when a CT scan or MRI is done for another health reason. So, how dangerous is this kind of silence? Don't underestimate it just because the symptoms aren't obvious. Each area of brain damage, no matter how small, is permanent. Over time, these marks add up and can lead to serious consequences. Progressive cognitive decline. It goes beyond simply being a little forgetful. Your ability to think logically, solve problems, and handle daily tasks starts to suffer. Increased risk of vascular dementia. A serious progressive brain condition caused by poor blood flow, difficult to reverse once it develops. A warning sign of a major stroke to come. People who've had silent strokes are at much higher risk of experiencing a full-blown stroke with severe consequences like paralysis, loss of speech, or even death. Mental health impact. It can worsen anxiety, lead to depression, and contribute to other emotional disorders. According to neurologists, silent strokes are far more common than most people realize. You may have already had one and not even know it. Remember, stroke, whether loud or silent, is still one of the leading causes of death and permanent disability worldwide. And early recognition is the key to long-term brain protection. To better understand stroke, let's start by focusing on the most common type: ischemic stroke. Picture this: blood is pumped from your heart to your brain through two main highways called the carotid arteries, located on each side of your neck. From there, blood branches out into smaller vessels throughout the brain. One of the most important and most commonly affected is the middle cerebral artery. According to statistics, over 80% of strokes happen when a blood clot, suddenly blocks blood flow through one of these vessels, cutting off the brain's oxygen supply. So what exactly is a blood clot? It's made up of two main components. Platelets, tiny blood cells that act like sticky patches. Fibrin, a natural protein that acts like glue, binding the platelets together. Your body creates clots as a protective response. For example, when you get a cut, a blood clot forms to stop the bleeding and seal the vessel. But things become dangerous when clots form in the wrong place, such as inside a damaged or hardened artery. In some cases, a clot doesn't form right there in the brain. It can travel from somewhere else, like the heart, or from plaque buildup in the carotid arteries. Once it reaches a smaller vessel in the brain, it can get stuck and block blood flow. When that happens, the part of the brain beyond the blockage starts to die from lack of oxygen, causing permanent damage. Doctors often use clot-busting drugs or mechanical procedures to remove the clot and restore blood flow to the brain. But here's the crucial part. If we only focus on treating the blood clot, we're just addressing the symptom, not the root cause. So what's truly causing these dangerous clots in the first place? The first major culprit is high blood sugar. When blood sugar rises, the body experiences oxidative stress, which damages the inner lining of blood vessels. This explains why people with diabetes, prediabetes, or insulin resistance face a much higher risk of stroke. A diet high in refined carbohydrates and sugar speeds up this process significantly. Sugar also fuels inflammation in the body and activates the sympathetic nervous system, also known as your body's high stress mode. Which brings us to the second root cause: adrenaline epinephrine, a hormone released during stress. Chronically high adrenaline levels cause blood vessels to tighten, increase inflammation, and force the body to rely heavily on glucose for energy. Chronic stress doesn't just wear you down emotionally, it also creates the perfect environment for blood clots to form, increasing the risk of a severe, life-threatening stroke. This is something worth reflecting on because now we can clearly see the connection back to the first major cause: high blood sugar. But here's the surprising part in this case: you didn't even eat sugar. Your blood sugar went up simply because of stress. When you combine a high-carb diet with chronic stress, you create a deadly Formula One that leads to a wide range of health issues, including stroke and heart attack. These are the real enemies we need to understand and take control of as early as possible. When it comes to chronic stress, it's important to know not all stress is the same. One of the most damaging types is emotional stress, especially major life shocks like losing a loved one, losing a job, or financial loss. These events push your nervous system into a state of constant alert, throwing off the body's ability to regulate blood pressure, blood sugar, and even hormones. There are also certain medications that can raise your stroke risk. For example, hormone replacement therapy, HRT, especially when used at high doses over a long period, and birth control pills, known to increase clotting risk, particularly in women over 35 who smoke. The fourth major risk factor is smoking. Some people wonder, how can inhaling smoke into the lungs affect the brain? The answer is cigarette smoke contains hundreds of toxic chemicals. Once they enter the lungs, they quickly seep into the bloodstream, which goes straight to the brain. There, these chemicals trigger oxidative stress, cause inflammation, and raise the risk of blood clot formation. Fifth, and perhaps one of the most critical factors, is high blood pressure. What's important to understand is this high blood pressure not only damages blood vessels over time, but it is also the leading cause of hemorrhagic stroke when a vessel in the brain bursts and causes bleeding in the brain. But here's a surprising fact: in nearly 90% of cases, doctors diagnose essential hypertension, which means they can't identify a clear cause. It may sound unbelievable, but many people live with high blood pressure and have no idea why. That doesn't mean there's nothing you can do. Research shows that high blood pressure is often linked to hidden lifestyle factors, and when you address these at the root, you can often lower your blood pressure naturally and sustainably. So what's the hidden culprit behind most cases of high blood pressure? The number one cause is insulin resistance, a condition where your body stops responding effectively to insulin, the hormone that regulates blood sugar. A diet high in sugar and refined carbs causes the arteries to harden and thicken, making it harder for blood to flow and raising pressure inside the vessels. And just like that, we're back to where we started: high blood sugar, the brain and heart's number one enemy. The second root cause: potassium deficiency. You might wonder, what does potassium have to do with blood pressure and blood vessels? Actually, quite a lot. Potassium helps keep your arteries soft and flexible. When you're low on potassium, your artery walls can stiffen, making it easier for your blood pressure to rise. Studies have shown that getting enough potassium can help stabilize blood pressure and lower the risk of cardiovascular complications. So, where does potassium come from? The best sources are magnesium-rich leafy greens, especially dark green vegetables. Here's the problem. The average adult eats only about 1.5 cups of vegetables per day, while the recommended intake is 4 to 5 cups of cooked vegetables or 7 to 10 cups of raw salad every day. Potassium deficiency doesn't just affect blood pressure. It can also lead to heart rhythm disorders, especially atrial fibrillation, which greatly increases the risk of stroke. Many people are also deficient in vitamin D and don't even realize it. Low vitamin D levels lead to increased inflammation throughout the body, which contributes to insulin resistance, prediabetes, and type 2 diabetes, all major stroke risk factors. That's why I always encourage people to ensure they're getting enough vitamin D, enough potassium, and following a low-carb eating pattern. This approach has shown clear success in reducing blood pressure and, as a result, significantly lowering the risk of stroke. So, when it comes to recognizing and preventing silent strokes, pay close attention to these factors. If someone eats a lot of refined carbs, has diabetes or insulin resistance, eats very few vegetables, lives with chronic stress and avoids physical activity, they're living with some of the most dangerous risk factors for stroke without even knowing it. That's why here are 4 proactive steps you can take starting today. 1. Adopt a keto-style diet combined with intermittent fasting. 2. Increase your intake of leafy greens, especially salads, to boost potassium and magnesium. 3. Exercise regularly. Nothing extreme, just consistent movement to release adrenaline and relieve pressure on the nervous system. 4. Eat nutrient-rich foods that provide vitamins, B, C, D, and E key nutrients for brain and blood vessel health. However, please remember the information shared here is not meant to diagnose or treat medical conditions. If you have a serious health concern, always consult a qualified healthcare provider. The goal of this YouTube channel is to help you better understand your own body so you can work more effectively with your doctors and take smart, proactive steps to protect your health.